This video is for informational purposes only and should not be considered medical advice. Always consult with a healthcare professional for medical concerns. Am I the only one that didn't know peripheral vascular disease, or PVD, and peripheral artery disease, known as PAD, are conditions that affect blood vessels outside the heart and brain? PAD is actually a type of PVD. It involves narrowed arteries that reduce blood flow to the limbs, commonly the legs, which can lead to pain and other symptoms. Atherosclerosis is a common cause of PAD. It happens when fatty deposits build up in the artery walls. These deposits can harden and narrow the arteries, restricting blood flow and potentially leading to serious complications, such as heart attacks or strokes. Both PVD and PAD are serious health issues that can limit mobility and affect the quality of life. Early diagnosis and treatment are important to manage these conditions effectively. Understanding the basic definitions of PVD and PAD helps in recognizing their significance. Knowing the difference between them is crucial for proper diagnosis and treatment. Atherosclerosis is the leading cause of PAD. It occurs when cholesterol and other substances build up in the arteries. This buildup, known as plaque, can harden over time, narrowing the arteries, reducing blood flow, and leading to blockages. Blood clots can also cause PVD. Clots can form in the arteries, blocking blood flow suddenly, which can be dangerous and requires immediate medical attention. Inflammation of the blood vessels, known as vasculitis, can also lead to PVD. This inflammation can cause the blood vessels to narrow or weaken. Other causes include infections and injuries. Infections can damage blood vessels, leading to PVD, and similarly, injuries can harm blood vessels, contributing to the development of PVD. Understanding these causes is key to preventing and managing PVD and PAD. Knowledge of the underlying causes can help in taking preventive measures and aids in understanding the treatment options available for these conditions. Several factors increase the risk of developing PVD and PAD. Age is a significant risk factor. As people get older, their arteries can become stiffer and more prone to atherosclerosis. Smoking is another major risk factor. It damages the blood vessels and accelerates the buildup of plaque. Diabetes is linked to a higher risk of PVD and PAD, as high blood sugar levels can damage the blood vessels. Similarly, high blood pressure can strain the arteries, making them more susceptible to damage and plaque buildup. High cholesterol levels also contribute to the development of PVD and PAD. Obesity and a sedentary lifestyle are additional risk factors. Excess weight can strain the heart and blood vessels, and lack of physical activity can lead to poor circulation and an increased risk of atherosclerosis. Family history plays a role as well. If close relatives have PVD or PAD, the risk is higher. Chronic kidney disease is another contributing factor, as it can affect blood flow and increase the risk of atherosclerosis. Recognizing these risk factors can help in taking preventive steps and managing the condition better. Symptoms of PVD and PAD. One common symptom of PAD is claudication. This is pain or cramping in the legs during activities like walking. It usually goes away with rest. Leg numbness or weakness is another symptom. This can make it difficult to move around and perform daily activities. Coldness in the lower leg or foot, especially when compared to the other leg, can indicate PAD. Sores or wounds on the toes, feet, or legs that won't heal are also warning signs. These symptoms occur because of reduced blood flow to the extremities. Changes in skin color, such as pale or bluish skin, can be a symptom. A weak pulse in the legs or feet is another sign of PAD. This indicates poor blood flow to these areas. Recognizing these symptoms early can lead to prompt diagnosis and treatment. Understanding the symptoms helps in seeking medical advice promptly. This can prevent complications and improve the quality of life for those affected by PVD and PAD. Diagnosing PVD and PAD. The ankle brachial index, or ABI, is a common test for diagnosing PAD. It compares the blood pressure in the ankle with the blood pressure in the arm. A lower pressure in the ankle indicates PAD. Ultrasound imaging is another diagnostic tool. It uses sound waves to create images of the blood flow in the arteries. Angiography is a more detailed test. It involves injecting a dye into the blood vessels. This dye makes the arteries visible on X-rays or other imaging tests. This method helps in identifying blockages and narrowing in the arteries. Blood tests can also aid in diagnosis. They can check for conditions like diabetes and high cholesterol that contribute to PAD. Early and accurate diagnosis is crucial. It helps in planning effective treatment and managing the condition better. Knowing the diagnostic methods can prepare individuals for what to expect during medical evaluations. Diagnosis is the first step towards effective treatment. It helps in understanding the severity of the condition and planning the appropriate course of action. Treatments and prevention of PVD and PAD. Lifestyle changes are crucial in treating PAD. Quitting smoking is one of the most important steps. Regular exercise improves circulation and helps manage symptoms. A healthy diet can lower cholesterol levels and reduce the risk of atherosclerosis. Medications also play a significant role. Antiplatelet drugs help prevent blood clots. Cholesterol-lowering medications reduce plaque buildup in the arteries. Blood pressure management is also essential. Controlling blood pressure helps prevent further damage to the blood vessels. Procedures like angioplasty can open narrowed arteries. This involves using a balloon to widen the artery, sometimes with a stent to keep it open. Bypass surgery is another option. It creates a new pathway for blood flow around the blocked artery. Atherectomy involves removing plaque from the arteries. Advanced treatments include endarterectomy, which removes plaque from the artery walls. In severe cases, amputation may be necessary. Preventing PAD involves managing risk factors and adopting a healthy lifestyle. Regular screenings can help detect the condition early, leading to better outcomes. Prevention and early intervention are key to managing PAD effectively. Understanding treatment options empowers patients to make informed decisions about their health. Please like and subscribe for more informative content.